Pleased to have Dr. Beck and Dr. Dickson with us tonight. Dr. Beck is certainly within Canada. He's one of the two foremost experts on the issue and debate of water fluoridation. And he's even internationally respected for it. He's co-author of the book, The Case Against Fluoride. Dr. Beck is a retired professor from the U of C. He got his medical doctorate at Washington University School of Medicine and his PhD in biophysics from the University of California in Berkeley. So Dr. Beck was also instrumental in testimony before Calgary City Council. The council's there, an advisor that led to the removal of fluoride from Calgary City water. So we're really privileged and pleased to have him with us tonight. So can I ask everybody to give him a warm welcome? Going to send around this petition for everybody to sign. If you've already signed it, then please don't sign it again. You signed it outside or at another location around Lethbridge. So you can be doing that while we get the lecture underway.
That while that petition is going around, I have a thought. Hopefully, there will be more of you who want to sign it now. More of you will want to sign it an hour from now than will want to sign it now, because I hope to convince some of you who have doubt about the wisdom of using fluoridation of our public water supply. Now, let me start by saying, in order to make a decision about whether you want fluoridation or not, you have to answer these three questions. Is it effective in stopping cavities?
Dr. Beck, sorry, I think we're probably cross-reading with something here, so I think if we kind of stand right here on this.
I'm willing to try it without the mic, but I might not last. So the first question is it effective? The second question is it safe for human consumption? And the third question is it ethical? And I'd like to take a few minutes at the end to discuss the precautionary principle, to use the precautionary principle as an instrument for examining the question, should we fluoridate certain water? Now, with respect to the first question on efficacy, if you could show the next slide. Yes. And this is not a systematic scientific study, but it's a huge amount of data. And what it is data gathered by the World Health Organization from early in the 1960s, about the time fluoridation was beginning to be widespread in Europe and in North America, until 2004. That time span is represented on the horizontal axis. On the vertical axis, we have what DMFT represents: decayed, missing, and filled teeth, which is considered to be a reasonable measure of the prevalence of cavities. So you can see that this plot is for data from 18 countries, industrialized countries. 4 of them were fluoridated, and 14 of them were not. And you really can't distinguish between them. So what started in the early 60s is a decline in cavities, in the prevalence of cavities in these industrialized countries. And that's when fluoridation started. Fluoridation prevents cavities. But since I'm in a university, I can show off and speak Latin with you. That is post hoc ergo propter hoc. That's a fallacy that logicians and philosophers have warned us about. It translates after which, therefore, because of which. So you see, what the promoters of fluoridation often argue is, well, after we started fluoridation, cavity and prevalence went down, so fluoride is good for that. But it went down in the 14 countries that weren't fluoridated just as much or more than in those 4 that were. So there's no evidence here for the efficacy of fluoridation as a preventative of cavities. So in the next slide, we can take another way of looking at this and bringing up another point at the same time. The top purple represents the percent of high-income children from high-income families who are found to have cavities. Then the blue, goes up and down, are the same kind of data for children in low-income families. Excuse me, that's the percent of the let's see how long. Okay. Yes, the percent without cavities. I'm sorry. Yes. So the high-income children have a better set of teeth than the low-income children, which is a very robust relationship with concentration of fluoride in the thinking water. More fluoride, with the prevalence of cavities. The higher the income, the lower the number of cavities of children. So the evidence was taken from 50 states, and that's what the black marks are. 50 states in the United States, and it goes over a range of virtually 0 up to virtually 100% of the population of state Florida. Well, it's not associated with any change in those 2 plots of the oral health of those children. So again, we have no evidence here of any causal relation indicating that fluoridation prevents cavities. In the next slide, we'll move the wrong direction. There. We're going to merge here from efficacy into toxicity. Because this slide shows us 2 things. On the horizontal axis, that's the concentration of fluoride in the drinking water. And on the vertical axis, the percent of children with either dental fluorosis, and I'll show you in a moment what dental fluorosis is, and those with cavities, caries. So you can see that the variation in the concentration of fluoride in the drinking water seems to have no effect whatsoever on the rate of the percent of children with cavities. Well, it does seem to have a clear relationship with the incidence of fluorosis. The more fluoride in drinking water, the more we're going to have dental fluorosis. Dental fluorosis is a toxicity that is probably the only one that is recognized by promoters of fluoridation. And no one denies that fluoride exposure causes dental fluorosis. Now, the clinical categorization of dental fluorosis goes, according to the Dean classification, it goes mild, moderate, severe. There are more levels in there somewhere, but don't be misled by the street meaning of mild. Mild dental fluorosis means that the teeth are have these discolorations, these white spots modeling on up to 50% of the tooth surface. And moderate means it has up to 100% of the tooth surface involved, plus pitting. And then severe fluorosis is quite a severe disease. Show the next slide. And you can see that these are illustrations of cases of mild, moderate, and severe. So in the next slide, we can move on to how much of a problem dental fluorosis is. Again, this is just one, and perhaps the least threatening toxicity of fluoride. And in this case, this is data from the CDC. Let's CDC, what's the
Disease control.
Yeah, the Center for Disease Control and Prevention in the United States, that institution is a promoter of fluoridation, well, endorses fluoridation. But this is data that they gathered in the total population of the United States, and those are the age groups on the horizontal axis, and the other is a percent of people in that age group with dental fluorosis. And you can see that overall, all the population, this includes fluoridated plus non-fluoridated areas in the United States, and overall, more than 30% of the people have dental fluorosis in the United States. We don't have that much data in Canada, but it's almost certainly similar in those provinces which have prevalence of fluoridated water supply. So, but notice in the 12 to 15-year-old group, it's 41%. Now, the monofluorosis is often said by promoters of fluorides not to be a disease, it's just a cosmetic effect. Now, forgive me, but that strikes me as incredible arrogance. I don't think I can convince a 14-year-old girl who won't go to parties or go out with her friends because her teeth are wrong, that it's just an unimportant cosmetic effect. But I think we owe those children more consideration than that. In the next slide, I want to talk about the more complicated issue of whether it's safe for human consumption. And I want to say at the beginning that there are many different systems of the human body that definitely are, or probably are, or may be harmfully affected by swallowing water with the levels of fluoride that we use in North America for fluoridate. Now, why is that? That seems too bad to be true. And sometimes those of us who oppose fluoridation are accused of scaremongering and exaggerating. But there are two very good reasons to expect many different systems, many different organs in the human body to be affected by fluoride. First of all, fluoride is a very effective poison for many enzymes. And the enzymes are proteins that our body produces that catalyze or facilitate chemical reactions. So every one of our organs depends on metabolism, which depends on the normal function of enzymes. The fluoride is such an effective and specific inhibitor of enzyme action that biochemists have used it in thousands of experiments to poison particular enzymes to study their effects. So that's one reason to expect multiple system involvement. The other reason is that fluoride, alone or in combination with other chemicals that are encountered in the body, can disrupt a system which carries signals across the membrane of a cell. Now, some things like hormones, there are a lot of hormones, and they do a very important job in communicating from one part of the body to the other, turning on cell processes or turning off cell processes. But they're water-soluble. They can't cross cell membranes. So the cells have developed a system of signaling so that if it senses the presence of something like a hormone outside, it can go through a process that signals the cell on the inside to turn on some system or turn off some system. Well, fluoride interrupts that signaling system. So that is another thing that is present in all the functions of the body. So it's not surprising, if you know that just a little bit of biochemistry and physiology, that you would expect so many systems to be affected. In the next slide, I want to say before, before stopping with the other side, I should say that the systems where we're quite certain that these negative effects, these adverse effects occur, are on the thyroid system. As a matter of fact, in the 1930s and 40s, physicians were giving sodium fluoride to patients in order to suppress their thyroid system when the patient had hyperthyroidism. So we know that it does that, but in addition to that, we know exactly how it does that. So there's different kinds of studies of such problems, you know. One is epidemiological. You look at a population and you give them some treatment and compare them to a population where they don't get that treatment. And that tells you that there may be some relationship. But then you want to know whether you can be sure that there's a causality that you don't know yet. So we have studies that give us what we call plausibility. You go to the laboratory, you do animal experiments or some sort of thing like that. And in the case of thyroid, as an example, we know what enzymes are poison, how to what degree, and with what time progression, and so on. So that's a very strong case. There's a less strong, but still convincing to me case that fluoride exposure is associated with hip fracture. And so this is one of the subsets of our population that is particularly susceptible to some adverse effects. They're elderly, and one of those effects is hip fracture, which is a very serious thing for an elderly person. And it's generally the case that if an older person is hospitalized with a hip fracture, they have about a 50% chance of death within a year. So this is another case of where fluoridation is probably causing some of us to have shorter lives and some of us to have lower quality of life. So another effect is on the reproductive system, where it seems to be associated with the earlier onset of menstruation occurrence. And in adult men, it seems to be associated with lower sperm counts and lower quality of sperm. There are effects on the vasculature, the aorta, and the heart muscle that have been observed in the laboratory studies. And there are apparent effects on the gastrointestinal system, and certainly on the kidney. And because a large population of a city has a lot of people in it, right? And people are different. And some of us aren't all entirely well, or some of us are at a particular age, and where we're more susceptible to some effects of fluoridation. Among those groups that are more susceptible than the average adult to exposure to fluoride are infants and young children. Their neurological development can be affected. Are kidney patients, because of the fluoride that a healthy person ingests is excreted from the body to the extent of about 50%, almost entirely through the kidneys. Then people with low iodine in their diet are more susceptible to effect on the thyroid system. And we observe higher level of goiter, for example, in fluoridated areas than in non-fluoridated areas. And there are others as well. I should say that the evidence is getting stronger and stronger in a number of these areas, but one is the association of fluoride exposure with lower IQ in children. And recently, it was published last year, a study from the Harvard School of Public Health, which used the results of 27 studies of this possible relationship between fluoride exposure and IQ. They discovered in 27 papers they felt were strong enough to observe the analysis. They did what's called a meta-analysis, which sort of sums up the results from all of these all the studies on a single question. And of those, there was one study that showed a small difference in the average IQ that was higher in the fluoridated group than in the unfluoridated group. But in 26, it showed the opposite. And when all of them were weighted for their value and their size of the study and so on, they came up with the result that there is a 7.7 IQ point difference in the average IQ of fluoridated and non-fluoridated population, but a fluoridated person's IQ is lower. So that's a very serious hit on a population. Because if you move that bell-shaped curve, the people at the two extremes, over here you have the geniuses that we need to keep us out of trouble. And over here we have people who psychologists call retarded, who need medical and social services. And by moving that over just 5 IQ points, you can increase that part of people in this needing social services from 2.5% to 4%. Now, if you're talking about a population of a million, that's a lot of people. And a long and a heavy burden on the society. So that I think makes the main points about possible harms. But I want to make one very general point about the possibility of harms. We're often told about the motives of fluoridation, well, you haven't proven incontrovertibly, without any doubt, that this is doing harm. But in some cases we have. But let's just give them that. Say, okay, we haven't incontrovertibly, definitely, unquestionably proven that fluoridation causes this harm. So we'll keep doing it until you show us it's causing harm. Now that is at best irresponsible. At worst, that's criminal nonsense. What is the right procedure in a case like that? The right procedure is not to do it until you're sure it's not going to cause harm, and then you start. I don't think that argument requires any science or any magic. It seems quite clear. Now, the last question I had up there at the beginning was, is it ethical? And I just want to say about that, and in terms of medical ethics, it is a requirement that a procedure or a drug not be given without informed consent of the person who's to receive it. And informed consent means that they have to have been interviewed by a qualified professional to whom they can question and be told what the expected benefits are, what the possible side effects are. It is also unethical to continue such a procedure without monitoring the effects on the individual. It is also unethical to have such a procedure in action where the person receiving it doesn't have the option to stop it. So those are 3 simple requirements of medical ethics for doing anything, whether it's a procedure, a change in behavior, or a drug. Fluoridation of public water supply fails on all of those, clearly. So even if it were effective, we shouldn't do it because it's unethical. Which leads me to the last part of the discussion I want to make, and that is the use of the precautionary principle to answer the question, should we have fluoridation? Because it helps us bring out important points about the process and about our responsibilities and deciding whether to apply. So if you screw that, next slide. So I've just given 5 questions that we have to answer using the precautionary principle. The first one, what is the expected benefit? Well, the expected benefit is at least those who promote fluoridation presumably expected to reduce the incidence of cavities. And that's a worthwhile goal. No question about it. But we have to look at it in the context of other factors, which we get to with the other questions. So keep in mind, yes, that's an effective, that would be a benefit, but we're not sure that it exists, judging from the work I told you about at the beginning. Then we have to ask the question, is there evidence of harm? And there's no, well, I'm afraid that the Alberta Health Services people keep denying that there's any evidence of harm. They do this while I'm on the phone with them with a stack of scientific papers that thick about harms, which they deny the existence of. So that question, yes, there's evidence of harm, and some of the evidence is quite definitive, like hip fracture, thyroid suppression. And there's much evidence where there's doubt. So we're working up to the point where we can try to balance possible benefits from possible harm against possible harm. Now, another important point about harms is to know whether they're reversible or not. If the fluoride exposure is affecting the fetus and the infant in such a way that they have lower IQ, that's not going to be reversible. There's some things like effects on the thyroid system which we can reverse by getting rid of the causes of those effects. And that would be, if it's a low hypothyroid condition, low thyroid function, then stopping the intake of fluoride is a likely cure of that. So some of the harms are reversible, but importantly, some are not. Now, are there risks in stopping? This is another sore point with me, because I've spoken with many town and city councils, and usually in the presence of medical and dental officers of health, and they often themselves, or they bring in some local dentist to say that you don't dare stop fluoridating your water, because instantly your children's teeth will be terrible, in terrible condition, and you'll never forgive yourself. Well, that question has been looked at with specifically designed systematic studies. There may, and dozens of them, there are perhaps one or two that show that when what you do here, in this case, you take two communities, which hopefully the populations are the same, except this one's fluoridated. This one is also fluoridated, but you're going to stop fluoridation here. And then you watch as time goes by and compare the two. So in one or two of these studies, there had been a slight difference where the city where it was stopped had more cavities than the control city. But in the dozens and dozens of others, it was quite the opposite. Either there was no difference, or the city that stopped fluoridation had lower incidence of cavities.
Lower incidence of what?
Of cavities. So that it shows that in addition to our doubts about the efficacy of fluoridation in preventing cavities, it shows that there's no harm and perhaps benefit in stopping fluoridation. That question has been answered by studying, hundreds of thousands of people. But I often encounter in hearings before councils a local dentist that says, "I want to know. I used to practice over there where there was no fluoridation, and now I'm practicing here where there is fluoridation, and there's much less cavity. And I know when you stop fluoridating, the incidence can cavities go up." Well, presumably she or he is an an honest person and may be capable of diagnosing caries as well as anybody else, but it's the study of one person's experience in one practice. And it doesn't weigh much against the studies of tens of thousands or hundreds of thousands. So essentially, there are no risks in stopping. And finally, are there alternatives? Alternatives that we could hope would prevent cavities. Well, that data we have from the World Health Organization, which showed this decrease in DMFT in cavities in those 18 countries, suggests that there must be some other possibility that we could apply. What other changes have occurred in those industrialized countries? Well, probably that all experienced better diets. Probably that all experienced an increase in availability of dental care. And hopefully they've increased the education of their children on taking care of their teeth. And perhaps they've all had more vitamin D in their diet. There's some evidence that that's a good preventative to cavities. So there are alternatives. And furthermore, even if you want fluoride to swallow, I hope no one does, but a lot do, apparently, and fluoridation is stopped, you can go to the pharmacy and get pharmaceutical grade sodium fluoride to swallow without the arsenic and without the lead. And it doesn't cost very much. And you do it of your own choice. So that's another alternative. Apparently, it's very suggestive. The observations over the years since fluoridated toothpaste came into use suggest that that is effective. And what it does is apply a high concentration of fluoride. Toothpaste in your water, you're getting something like 0.7 to 1 part per million concentration of fluoride in your drinking water. Toothpaste will have 1,500 to maybe 3,000 parts per million. So there's a lot of fluoride being applied on the surface of the tooth. And that, it's generally conceded now that that's effective in preventing cavities. Even the Center for Disease Control and Prevention says, well, the effect of swallowing it is almost nothing, or nothing. But there's a topical effect. Other studies have shown this to be apparently the case. Even the American Dental Association, they change their minds all the time depending on the pressure of the government. But they've admitted, this goes back to as long as 1999, that the effect is topical, directly on the enamel. So why swallow it? In fact, the instructions for using fluoridated toothpaste are that you brush your teeth and you rinse your mouth thoroughly and repeatedly and spit it out. Because there's no need to swallow it, and it may be harmful to swallow it. So there are alternatives that give us choice that might well be very effective. And we won't need fluoridation. And it won't be such a hot issue. But I think that I've made most of my points, and I've left out, stacks of scientific literature that high. But I want to assure you that what I've told you is backed up by credible research. And I think if I stop now, I want Dr. Dickson to have a few minutes, but if I stop now instead of 15 minutes from now, you'll have time for more questions. And I'll welcome your questions. Thank you.
you're okay in the back, not this, because I'll think you're doing a good job, Dr. Bob. So up like this, not one of the other fingers, please.
Hold on, I forgot to tell him.
Unlike Jim, I'm not so technologically advanced. This is my BlackBerry, so I'm going to use that as the PowerPoint. So I'm just going to tell you a little bit about my own journey. I'm a family physician in Calgary, and I was actually pro-fluoride. Well, there is no knowledge about fluoride until 1998. And in 1998, Calgary had their their seventh referendum, their seventh plebiscite. The first five from the 70s and 80s had defeated fluoride. The last two, 1989 and 1998, actually passed fluoride by about 2%. So that means a very small percentage of the population voted, and only 2% of that group actually passed fluoride. I was one of those that voted for fluoride. And my friends and some colleagues came to me afterwards and said, "Why did you do that?" And I said, "Well, I'm a busy person, like most of the family doctors and dentists out there. We have a plethora of information to go through to learn. We have thousands of studies that come out every year, reports of medical knowledge, and we can't keep up on anything. So we have to trust the medical experts, the people that actually supposedly do the research and know about these things." And so I trusted the Calgary Health Region in particular. They give me good information. So they said, "Well, maybe you should look at the information yourself." In that particular referendum, the Calgary Health Services had $250,000 to spend on advertising. And back in 1998, that was a fair bit of money. So they put out a lot of glitzy brochures, information, TV, radio to promote fluoridation. A lot of which, as I found out later, was false. The anti-fluoride groups had $0, not a single cent that they had to promote anti-fluoridation, or to put the facts out there. So when I started looking at the information in depth, I was abhorred by what I found. I'd actually voted for something that was causing harm to my patients. And I'm in this business to make my patients healthier, to keep them healthy, to promote health, and to keep them out of hospitals and places of illness. I'd rather keep my patients out in the community with me. So, as an ethical doctor, I could not promote fluoridation any longer. And once I knew the facts and started spending more with Dr. Beck, I just could not be silent any longer. So then, at that point, in 1999, actually, Dr. Beck and I started. It's been going on for so long, he thinks it's only about 10 years, but it's actually been 14 years that we've been doing this. It's been a long journey. Dr. Beck, I just have to commend him. He's done so much incredible work over the years. He's put his heart and soul into this. So, Jim, I thank you for that. So, another prominent Canadian, I think the second one, that Mark is referring to as being the two top experts in Canada. I think Dr. Beck is one of those two, and Dr. Hardy Lineback in Toronto, who has just retired from the head of preventative dentistry at the University of Toronto, is the other top expert in Canada. These two know more than any other doctor, any dentist, any researcher in Canada about fluoridation, or water fluoridation in particular. Dr. Lineback was a great proponent of fluoridation for many years, in the 80s and 90s. And then he, like me, around 1998, started really looking in depth at the information, and he too became very important at what he found, and became one of Canada's strongest anti-fluoridationists, at least as much as he could within the realms of the professional organization and with his position at the University of Toronto. He obviously couldn't speak out very loud a lot of times, but he's done a lot in the last 15 years to actually put the message out there. So if you want to research anything, look at Dr. Hardy Lineback's work, and he is indeed an expert as well. So he's been one of Canada's best anti-fluoridation experts in the last 15 years. Jim mentioned the ethics and morality. Sorry, how do you spell that? I'm sorry, Lineback, L-I-N-E-B-A-C-K. Hardy is his first name, H-A-R-D-Y. So Jim mentioned the ethics and morality. That is how you're going to get it out of Lethbridge's water. That's how we're going to get it out of Fairview, out of Red Deer, out of the other 40% of Canadian cities that are still fluoridated. It's the morality and ethics of water fluoridation that's going to convince the majority of city councillors to actually come on side with us. They have so much science to balance out from both sides.